The final presentation for this session is Analyzing the Financial Impact of Child and Teen Firearm-Related Mortality in the United States, to be presented by Megan Paul.
My name is Megan Paul, and I'm a rising fourth-year medical student at the Icahn School of Medicine at Mount Sinai. Thank you to my mentor on this project, Dr. Brian Coakley. We have nothing to disclose. Firearm-related violence has increasingly impacted the U.S. population, with over 200 Americans killed or injured daily by guns and over 300,000 gun deaths in the last decade. Moreover, according to a recent study in the New England Journal of Medicine, firearm-related injury has recently become the leading cause of death in U.S. children, as seen in the graph on the screen, and it is a top 10 leading cause of death among the overall U.S. population. Further, over 6,000 children and teens were killed or injured by firearms in 2022, which was the highest number ever recorded. 50 school shootings accounted for 31 firearm-related deaths in children in 2022, 19 of which came from the school shooting in Uvalde, Texas. However, few studies have actually analyzed the cost of these deaths. Therefore, the aim of this study is to determine whether gun laws or restrictiveness measures and Medicaid expansion across states are related to the economic burden of pediatric firearm-related deaths. First, the CDC's web-based injury statistics query and reporting system, WISCARS, was used to determine both the medical costs and the value of statistical life lost from pediatric firearm-related deaths by state between 2015 and 2020. A sample of the output from this database can be seen to the bottom right. Medical costs include the inpatient hospital costs, emergency room costs, and any additional healthcare-related cost accrued, whereas the value of statistical life lost can be defined as the monetized value of work-related losses and societal productivity losses due to firearm-related deaths in children. 8 firearm-related laws or restrictiveness measures and the status of Medicaid expansion were collected over the same time period, including assault weapon bans, child access prevention laws, firearm registration requirements, permit requirements to carry, permit purchase requirements, safe storage laws, the total number of firearm provisions in a given state, and the Giffords Law Center ranking. The Giffords Law Center rankings rate each state from 1 to 50, with 1 being the state with the most restrictive gun laws and 50 being the state with the loosest gun restrictions. We conducted 18 separate unadjusted linear regressions with each of the gun laws or restrictiveness measures or Medicaid expansion as the exposure, and first medical costs as the outcome, and then the value of statistical life lost as the outcome. An example of the unadjusted output with all of the state's Giffords Center rankings and medical costs are displayed in the graph below as a way to visualize how each of these regressions looked. We then repeated these with an adjusted or multivariable linear regression, controlling for educational attainment, poverty, poor mental health, and race by state. Overall, Alabama had the highest medical costs due to pediatric firearm-related deaths, while Massachusetts had the lowest medical costs due to pediatric firearm-related deaths, depicted in the top heat map. South Dakota had the highest value of statistical life lost, and the lowest value of statistical life loss was also in Massachusetts, depicted in the bottom heat map. California had the lowest Giffords Law Center rankings, representing the strictest gun regulations, whereas Arkansas had the highest Giffords Law Center rankings, representing the loosest gun regulations. The medical costs due to pediatric firearm-related deaths are displayed in the heat map to the top, whereas the value of statistical life are displayed in below. In the unadjusted analyses, which are displayed to the left, 6 of 8 firearm restrictions and Medicaid expansion were associated with lower medical costs, with only child access prevention laws and permit requirement laws not associated, versus 7 of 8 restrictions or Medicaid expansion were associated with the lower value of statistical life lost. And the adjusted analyses controlling for poverty, educational attainment, poor mental health, and race by state, 5 of 8 restrictiveness measures and Medicaid expansion were associated with lower medical costs in the pediatric population, with only permit to carry requirements, child access prevention, and safe storage laws not associated, versus 6 of 8 restrictions were associated with lower value of statistical life lost in the pediatric population, with only permit to carry and child access prevention laws, as well as Medicaid expansion not associated. To interpret these results, if you look at the Giffords Law Center ranking and the adjusted analyses, each 1 unit increase in the Giffords ranking, meaning looser gun restrictions, is associated with a 41.64 increase in the value of statistical life loss due to firearm-related deaths. While this number may seem small, multiplying it by the statewide childhood population can have a significant impact. Ultimately, we see that states with fewer firearm restrictions and those which have not adopted Medicaid expansion had higher economic costs due to firearm-related deaths in children, and many of these relationships held true after controlling for poverty, race, educational attainment, and poor mental health by state. Future research should look into how individual firearm restrictions may reduce cost and potentially decrease gun violence. Because of the ongoing epidemic of firearm-related violence in our nation, we believe that quantifying the economic impact of pediatric firearm-related deaths in an evidence-based study such as this one can better demonstrate the financial toll of gun deaths to policymakers so that they may potentially enact more restrictive regulations to possibly reduce such deaths. We would like to acknowledge all of the victims of gun violence and their families across the United States, including my own hometown community of Sandy Hook, Connecticut, and here are our references. Thank you so much for listening, and I'd be willing to answer any questions you may have.
Chris Newton from UCSF. Quick question. The framework that you used, pairing up economics with policy and life loss, did you get down to looking pre and post the delta when specific regulations were implemented?
Yes, that's a great question. So first, it was a little hard to incorporate a potential lag time because it's unclear exactly how long these laws will take to be effective. However, what we did do was we averaged out so states after they passed law were given a 1 in the regression before they were given a 0, so we averaged that out to create a flat value over the time period of 2015 to 2020. But looking into an analysis where we could potentially account for the lag time would be interesting, but that's how we were able to account for the change in a gun law for some states over the time period.
Okay, thank you.
Thank you.